And the scenario is you're coming across a healthy 40-something-year-old man who had a gallbladder removal. And the nurse comes back around to see how the patient responded to the medication, but finds him unresponsive and calls routine. Think about it, go through it as you have on these other cases that you've seen through the course of the year.
What is it?
It's hypoglycemic, and it's triggered a seizure. That's my thought process.
What's the ultimate seizure medicine?
Anesthesia?
General anesthetic, a paralytic agent.
Yeah.
Does everyone think lorazepam?
Yeah.
Okay.
So that's why it's so important to continue to treat the hypoglycemia and anticipate. Otherwise, I was telling the other, it's going to be a long night for you by the bedside.
You guys have introduced treatments for sugar, blood pressure, and you've introduced treatment for maybe alcohol withdrawal. And is there anything else that you need to consider? So you might start to think about that's an important observation. He's sweating and he's a little tachycardic.
I've had double vision for the last 3 weeks. It's getting worse.
When did it start?
I noticed when I was driving home from work.
Follow my finger.
Okay.
Cover your left eye.
Okay.
Can you read this line?
I can't read that line.
How many fingers do you see?
4.
What I want to do is provide a role model as best as I can in how real doctors deal with real problems with real people.
And so how regularly are you checking your blood sugar?
So we're dealing with highly intellectual, intelligent, skilled folks that privileged to get into the UCF College of Medicine. And they learn a lot of facts. My job is not so much to focus on the facts as to understand what it means to be a doctor.
You're not just reading out of a book, but you're watching an expert work. And then being able to be a part of that process just makes you want to be at that level, so you try even harder with these patients to get to that level.
And it takes a lot of practice, but there's no reason to wait till 3rd and 4th year to start doing those clinical skills. It's time to do it now, so I'm thankful that we're able to do it.
And it just shows that you get a commitment to not just treating a disease, but treating a person. And I feel like he really creates an environment where a person's identity is not just based on their disease or their condition.
Standardized patient is a person who does not have an illness, but comes and helps us present an illness to a medical student who is learning about them.
I've had headache, I've had abdominal pains, I've had chest pains, I've had back spasms.
They really want to help. They really want to get into that role. One component of it is professionalism skill.
Nice to meet you.
Nice to meet you.
Do they welcome the patient? Do they introduce themselves?
I'm going to feel your thyroid gland.
Gives the student an opportunity to practice in context. A room that looks like an actual physician's room, where the equipment is there and available, and it's the real equipment that fits in their hand exactly right.
Many of us haven't actually ever dealt with patients out in the real world, and so now we're here face to face with somebody who's going to be reactive to our questions, and not only our questions but our facial expressions and how we talk and how we phrase the questions, and so it gives us a little bit better realistic feedback that we wouldn't get from, say, a professor or a fellow student.
I'm helping somebody to learn something. I'm trying to help these students become the best doctors they can possibly be.